Cholera cases have surged around the world this year, with outbreaks reported in 26 countries and fatality rates rising sharply. Malawi is currently experiencing one of the worst cholera outbreaks in years. Chancellor tells us why the disease is a public health threat.
World Health Organization describes cholera as an acute diarrheal disease which can spread rapidly in areas with inadequate treatment of sewage and drinking water. A person can get cholera by ingesting food or water contaminated with cholera bacteria. It takes between 12 hours and 5 days for a person to show symptoms. While many cases have mild or no symptoms, it can kill within hours if left untreated. The rapid loss of large amounts of fluids can lead to death within hours. Severe cholera can also lead to kidney failure, shock, and coma. Cholera affects both children and adults, but it is more severe on children because of their weak immune systems. With an estimated 1.3 to 4 million cases of cholera every year, how then can we prevent the disease? United Nations agencies, including the World Health Organization, recommend provision of safe water and sanitation, which is critical to prevent and control the transmission of cholera. Cholera vaccines for preventing disease. With 85% protection for the first 6 months, the efficacy declines to less than 50% after 2 years. The good news though, cholera is treatable. Oral rehydration solution is the primary treatment with intravenous fluids for severe cases. Chancellor, CGTN.
Let's bring in Dr. Joachim Osur, Vice Chancellor, AMREF International University. Dr. Osur, thank you for joining us. Now, cholera has been spreading sporadically in Malawi, with a caseload at nearly 4,200 and the death toll 117. What is driving this spread?
Thank you. Cholera is a disease which is spread because water is contaminated by human waste. So whenever there is a cholera outbreak, we want to see at what point is the water getting contaminated. The human waste could be from the toilets that are overflowing, or it could be because people are using, lawns outside to help themselves. And then water is, that waste is carried into water, which then people use for drinking and for cooking. And that brings the contamination because they drink the bacterium that causes cholera and they get the symptoms. So whenever a cholera outbreak happens, what we would like to find out is what is the point of contamination. And many times there are many sources of contamination, and we need to correct that. So it's not just a Ministry of Health problem. It is a problem that cuts across water, those concerned with water supply, the sewage system, those who manage it, and also housing and generally settlements, because many times you find where there are too many people settled together and the sanitation system is not working, then the contamination happens, and then you end up with the outbreaks.
The World Health Body, WHO, is warning cholera outbreaks are becoming deadlier as well as more frequent. In the case of Malawi, is the country equipped to deal with this outbreak? How are the health services coping?
Yeah, so the problem we have in Malawi and in most countries in Africa is that the health system, even without an outbreak, is already weak. It's not well funded. The system is such that the connection to communities is very weak. Community health workers are not always available to work with households to improve the status of health in the family. And so when an outbreak like this strikes, it finds an already very weak system and it spreads very fast. Malawi is not exception in Africa. It's one of those countries where the system is very weak, it's poorly funded, the human resource is inadequate, and even health facilities are widespread apart, so that reaching them is not very easy. In a normal working system, cholera should not kill, because all that is needed is to make sure the person is getting rehydrated in good time. They're getting water into their system, because basically cholera leads to loss of water in the body through very severe watery diarrhea. And if it is not being replaced quickly enough, then you find that the kidneys fail and other organs in the body fail. So in a working health system, cholera should not kill. But what we are seeing in Malawi is a death toll of about 3.8% going to 4% almost, which is very high. And so it is the weakness in the sector, in the health system, that is leading to all these deaths.
Oh, I thank you very much, Dr. Osur, for that. Dr. Joachim Osur joining us live from Nairobi.